What else can you do in addition to a goniotomy?
Trabeculotomy.
Trabeculotomy. Trabeculotomy is similar. Goniotomy or trabeculotomy, a concept is somewhat similar. Trabeculotomy means that we take a part out of the trabecular meshwork. This is a video of a trabeculotomy. I cannot play it over here because of its privacy. I think आप लोग part import visit करके you can watch it on video. If trabeculotomy is and trabeculectomy is state.
गोनियोटमी तब की जाती है जब कॉर्निया क्लियर हो और अगर क्लियर ना हो तो ट्रेबिकुलेक्टमी की जाती है. इसका क्या
trabeculectomy की जाती कहाँ लिखा हुआ है ये? I haven't read this.
ये जतोई में लिखा हुआ है कि गोनियोटमी तब की जाती है जब कॉर्निया क्लियर हो, अगर वो ना हो तो फिर ट्रेबिकुलोटमी की जाती है.
ठीक है. Right? I haven't read this actually, so this is something very knowledgeable is आप आ रहा है. Thank you for letting me know. So, as you're telling us, so if the cornea isn't clear, we will perform a trabeculotomy and trabeculectomy.
Trabeculotomy.
Trabeculotomy, ठीक है. So after Cheka, I haven't read this in Joki or in person, so I'm not sure. मुझे दोबारा पढ़ लेना चाहिए एक बार. But the thing to take away is that these are the three surgical options. Indications have been contraindications, but these are the three options which you will keep in mind. Now we have our treatments, we have our diagnosis, investigations all around. Let's review these. So this is a patient of infantile glaucoma. What is infantile glaucoma or what is congenital glaucoma? That is the first thing which comes into mind. Who will be labeled a patient of infantile glaucoma or congenital glaucoma? Why not iridotomy? Acha. So इसको पहले आंसर कर देते हैं. In iridotomies are usually performed if the angle closure is due to the iris pushing up against the angle closure. Angle closure it's done when the iris is pushed up against the angle. जिसकी वजह से angle closure हो रहा है. However, if this root of the iris यही यहाँ पे नहीं है और यही आगे चली गई है, it's actually closing the angle. That is correct. But performing a peripheral iridotomy somewhere around here, it won't help. Iridotomy में ये है कि it helps to make a pathway if something is causing a blockage over here, or if this part has moved in contact with the cornea over here. नीचे ही मसला आ जाता है, तो you can see how an iridotomy will not help in this case. ठीक है? Some people might have tried iridotomy at start, but हो सकता है. But the thing is that these are the three surgical procedures which have the greatest efficacy in treatment. These trials की बात ही पता लगती है. In the trials, yes, they might have used and tried an iridotomy to treat this. The first thing, what is an infantile glaucoma? What age do we label a patient as having infantile glaucoma? First thing, what is infantile glaucoma? What is the age limit for infantile glaucoma? थोड़ी बहुत बातें मुझे भी confuse करती थी. So let's take a moment to clarify them. A patient will have infantile glaucoma if their IOP is raised and their age is 3 to 4 years. This is what we call an infantile. अब थोड़ी बुक्स में discrepancy है, जोगी और पार्सन्स में somewhat different. But the thing is that they've written infantile and developmental glaucoma in the same heading. Developmental / infantile glaucoma in the same heading, and they said that from birth to age 3 to 4, if there is any glaucoma, any raise in IOP, from birth to age 3 to 4, this will be termed either as a developmental glaucoma or it will be termed as an infantile glaucoma. This is the first thing. What is a juvenile glaucoma then? Juvenile glaucoma क्या होता है?
Which develops between the age 3 years to 16 years.
16 years. So in brief terms, क्योंकि हर book में थोड़ा बहुत different हो जाता है, it's a glaucoma which develops in adolescence. The juvenile glaucoma उसको कहते हैं. Yes, 4 to 10 years भी होता है, 3 to 16 भी होता है. The thing is that in childhood or adolescence, if a glaucoma develops, that is called juvenile glaucoma. So we can see that our patient, she falls in the first age group, and she has a raise in IOP, and that is causing that we have termed a juvenile glaucoma. So visual acuity, fixate and follow reflexes. It means that her eyes are visual acuity is good. It's normal. The tonometry tells us that the raise in IOP is 34 millimeters of mercury. अब investigations में पता लग रहा है the axial scan is increased, the corneal diametry is increased, topography में bulging as such नहीं है. So why do you think these changes are happening? Let's have a everyone please mute your mic if you don't have to answer. It's a request. Highly appreciated. So let's मैं भी बोलता हूँ सिर्फ. So let's draw the conclusions. This patient, the initial lesion or the initial pathology in this patient is that the iris is inserted over the trabecular muscle. In other terms, the iris can have a higher insertion. ठीक है, मैंने simple कहने के लिए इसको इस तरह लिख दिया. Now this is causing an closure of the angle. अब angle close हो रहा है थोड़ा बहुत, so that is why the intraocular pressure in that eye it is being raised. ठीक है, intraocular pressure भी raise हो रहा है. Now the question arises, why does the axial length increase in this patient? We discussed angle closure glaucomas in elderly patients, so we didn't notice anything wrong with them. उनमें तो हमें कोई मसला नजर नहीं आया था कि उनमें तो axial length हमें आइस एग्जामिनेशन में भी बड़ी नजर नहीं आ रही थी.
ये जो एज है वो आई बॉल की ग्रोथ की एज होती है इसलिए.
बिल्कुल, that is the reason. Now, what happens is that in earlier ages, in this age, the lens is somewhat larger. The eyeball is growing, or eyeball, we know that it grows up to the age of 7 to 8 years. Distensible hoti hai eyeball, that is correct. So that is why due to the raised intraocular pressure, the eyeball, it starts to grow. क्योंकि सारी eyeball pressure को accommodate कर सकती है, that pressure causes growth, and that is why the eyeball, it becomes larger. This large eyeball, this growth of the eyeball, it has been given another term, which is a buzzword. Does anyone know what that buzzword is? I'll write it over here. Ophthalmos. What is ophthalmos? Ophthalmos क्या होता है? I'm not the vexologist या जो भी कहते हैं, who knows मतलब कि words कैसे रहेंगे, but इसकी जो translation दी हुई है,
enlarged cornea.
No, it's not an enlarged cornea. Ophthalmos means bullseye. Something like a bullseye or something like an ox's eye. That is why it has been termed ophthalmos. Now, I don't know why they termed this, but this term ophthalmos, it actually means this. Ophthalmos is another term, or it is used synonymously with infantile glaucoma, meaning that the eyeball is large, or it's enlarged due to the raised IOP. Macrophthalmia is a broader term. We'll discuss this. हम इसको discuss. If I don't discuss this, मुझे please याद करा देना. हम refer to this. So the eyeball is extensible. It can accommodate the raise in IOP, and that is why it increases in size. And that is why the cornea also increases in size. The axial length increases in size. There is an overall a universal growth of the eyeball in size. There are few terms which are similar to ophthalmos and which confused me because in सारों में कोई ना कोई चीज बड़ी हो रही है, something is growing and something isn't. So let's discuss them. वो होती क्या? I'll write those terms down. The first is a macroophthalmia. Macroophthalmia, it means a large eye in simple terms. So one is macroophthalmia. One is keratoglobus. Third is a megalocornea.
Exophthalmos.
Megalocornea. Then fourth we have an exophthalmos. These are similar conditions which confuses क्योंकि हमें पता नहीं है अभी क्या है. They sound very similar because macrophthalmia, right? इसकी भी आँख बड़ी है तो it can be macrophthalmia. So what is एक आँख? What is a keratoglobus? What is a megalocornea? These are some terms we want to discuss right now. Back to again. This is great. First is macrophthalmia. If anyone knows, आप बता दें. Otherwise, I'll tell them one by one. First is macrophthalmia, and the second is keratolobus. Then we have, today we call it the keratoconus. Then we have a megalocornea. Then we have an exophthalmos. These are some terms which confuse us, and they are similar to upophthalmos. Now let me tell you what upophthalmos is. अच्छा किसी के तोते बहुत ज़्यादा बोल रहे हैं. I'm sorry, I'm going to mute everyone. किसी ने आंसर देना हुआ तो please unmute their mics. So what is ophthalmos or infantile glaucoma? Infantile glaucoma or ophthalmos is an increase in eyeball size, meaning that there's an increase in axial length as well as an increase in the corneal curvature due to a raised intraocular pressure. This is ophthalmos, the term which we discussed first. So ophthalmos, I'll write it down first. It is a raised increased size in IOP due to raised IOP. Now that is ophthalmos. What is macrophthalmia? Macrophthalmia is a generalized term used to describe any eyeball that is large. So, what is macrophthalmia में कुछ भी हो सकता है. It can be a keratoglobus. मतलब it's a general heading and in which there are different subheadings including ophthalmos, keratoglobus, keratoconus, कुछ भी हो सकता है. Yeah, patient has macrophthalmia. हमें देखना है कि does he have ophthalmos, large size due to raised IOP? Does he have a keratoglobus, megalocornea है? What is it? So keratoglobus. What is a keratoglobus? Keratoglobus is also called as megalocornea. I'll have to confirm this, but Joy says that these are the same thing. Jogi says that these are the thing. If they're not, I will correct this. So keratoglobus or megalocornea means that the corneal curvature is enlarged or increased. हमने इस पेशेंट में कितनी बात की थी corneal curvature की in our patient who had ophthalmos? बात नहीं की, चलो ठीक है. Corneal curvature is enlarged, it's increased without rise in IOP. You know, this is a very important difference. Without rise in IOP, without cupping. The features of glaucoma or glaucomatous changes, they are not present. However, the corneal curvature is still increased. Corneal curvature बढ़ा हुआ है. Now, one more difference between keratoglobus and megalocornea and ophthalmos. It is the change without rise in IOP, without cupping, with normal angle. So you see that we have three differences over here between keratoglobus and megalocornea. The first is that in both they have an increase in corneal curvature, which is greater than 13, I think micrometers होता है. I'm not sure मैं confirm करूँगा, आप पढ़ लीजिएगा. So both have an increased corneal curvature. However, ophthalmos is due to the raise in intraocular pressure. And ophthalmos is a glaucomatous change. Also पूरा increase करता है. In keratoglobus or megalocornea, only the cornea or the anterior part of the eyeball is increased in size. The corneal curvature is increased. However, there is no intraocular pressure raise, there is no cupping, and the angle is normal. In ophthalmos or in congenital or infantile glaucoma, there was something wrong with the angle. That is why we were having an increased IOP. ये हमें दो terms पता लगे. What is keratoconus? Keratoconus and keratoglobus are somewhat similar. Difference ये है कि in globus, the corneal curvature, there was a globe-shaped protrusion of the cornea. In keratoconus, we have a cone-shaped protrusion of the cornea. there needs उसमें IOP change नहीं होता. It has its own change. It has its own signs, own symptoms, astigmatism, etc. You know those. We don't have to repeat them. Last is exophthalmos. अब exophthalmos क्या होता है? Exophthalmos is a protrusion of the eyeball. मतलब if this is our eyeball, and if it's protruding behind the orbit, normally इतना सिर्फ eyeball बाहर निकली होती है, somewhat around this area. If more of this is excluded, मतलब the eyeball it's moved forward, so that is called exophthalmos. उसकी literally meaning ये है बाहर निकलना, ophthalmos the eyeball. In eye or in ophthalmology, exophthalmos means the protrusion of the eyeball, specifically in the context of thyroid eye disease. Thyroid eye disease, Graves' disease जब होता है, so we know that there is protrusion of the eyeball. That protrusion of the eyeball, it is called exophthalmos. बाकी conditions में इन्हें क्या कहते हैं इस protrusion को? बाकी conditions में क्या कहते हैं? Can anyone tell me?
Orbital cellulitis.
The orbital cellulitis, proptosis. Orbital cellulitis is a diagnosis. So the sign is proptosis. It's called proptosis in other diseases. In the context of thyroid eye disease, it's called exophthalmos. Okay, so it's a subtle difference. Now, if exophthalmos is the protrusion of the eyeball, then what is this? ये क्या था? In which the eyeball it's being pushed backward, pulled backward. Yeah, it's going backward. It's moving backward.
Enophthalmos. Enophthalmos.
Yes, not end ophthalmos. It's enophthalmos. Ophthalmos. X की जगह N आ गया. So that was the difference between these two. These are somewhat similar meaning terms, and they are similar, but you have to differentiate them, especially between ophthalmos and keratoglobus or maculocornea. One is a congenital, one is a degenerative condition. वो चीज़ अगर ना भी पता हो, तो remember that raised IOP causes cupping, and there's an abnormal angle in ophthalmos. These changes are not present in keratoglobus and maculocornea. So this was congenital infantile glaucoma. With this, we've finished with glaucomas. So before we end this session, I want to talk to you about lasers. So let me just write it down. There are 3 types of lasers which you have to remember. It's a little bit about the concept. आप lasers देखेंगे तो आपको पता. Now that is a good question. This patient can have myopia. Now, one of your colleagues asked that if the axial length is increasing, why does this patient not have myopia? So the first thing is that myopia means that the light rays are falling in front of the cornea. So we cannot tell whether this patient has myopia, first of all, because हम इसका करवा नहीं रहे एग्जामिनेशन और रेटिनोस्कोपी पे भी जो है वो हमें इतना नहीं अंदाजा हो सकता. इसकी रीजन क्या है? If you remember when we discussed strabismus and all that, and if you don't, the thing is that a child is born hypermetropic. बच्चों की eyeball छोटी होती है, the lens is very powerful. Sorry, it's not powerful, eyeball बस छोटी होती है. So what happens is that the light rays they fall behind the retina. The child is hypermetropic. As the eyeball it enlarges, what happens is that the light rays they fall on the retina, उसकी वजह से बेहतरी आ जाती है. So in this child, as we've not done the retinoscopy, ज़्यादा confusing हो जाता. We cannot exactly tell whether this patient has a myopia or not. But even if this increase in corneal curvature was causing a myopia, उसकी वजह से अगर myopia हो भी रहा होता, so the thing is that it would have been counter to the normally present hypermetropia. You're right, these changes they happen. इसकी वजह से myopia होता है. And that is why high myopia में भी eyeball बड़ी होती है. आपने मुझे याद करा दिया, it's good. So another differential which you have to consider when eyeball is especially large is high myopia. कौन सा myopia? High axial myopia. ठीक है? So these things they happen. ये सारा कुछ हो जाता है. It's a physiological मतलब physiological response, and these things they happen. That is good concept on your part. So, कहने की तरफ आते हैं. I want to talk to you about lasers. What are lasers? ठीक है, we know what are lasers. We don't have. There are 3 types of lasers which are commonly used in ophthalmology. थोड़ा सा concept आ जाता है, easy हो जाता है. I'll tell you one type of laser of each and one use. I'll show you one use. So I'll tell you the types and I'll show you the videos. Video के ऊपर लिखा भी होगा कौन सी है. You will have to tell me which kind this is. So one kind of lasers is photocoagulative. One kind of lasers is photoablative. The third type is an excimer. There are 3 types of lasers which are generally used, or the 3 types which I'm going to show you right now. So let's see this first video. What is happening in this first video? If anyone has the retina का जिसको concept है, तो it's not difficult to imagine what is happening. I'm sorry, I had to mute you. So if you don't understand what's happening in this picture, this is the pan-retinal photocoagulation. दरमियान में slits के नजर आ रहे हैं. This is the retina. Now we cannot actually see the vessels, so this is a better slide or better examination. These are the retinal vessels, and if you look closely, this red dot is the laser. They're applying a laser on the retina in order to photocoagulate. This is photocoagulation, focal retinal laser or focal retinal photocoagulation. This is done in diabetic retinopathy, it's done in CRVO, it's done in ROP, and other proliferative diseases. So the first question is, what laser is being used, or what laser is commonly used? The second question is, which of the 3 types of lasers is this? So anyone knows? Well done, excellent. आपको पता है. Let me write it down. This is a photocoagulative laser, which is used in pan-retinal photocoagulation. But a simple, the laser which I want you to remember as example is argon, and use हमने देख लिया कि it's used in pan-retinal photocoagulation. This is a video of pan-retinal photocoagulation in which slit lamp examination जिस तरह कहते हैं उसी तरह हो रहा है in this patient. We're using a lens to view the retina, and through that lens we're applying laser in order to destroy the ischemic diabetic retinopathy. For a concept of diabetic retinopathy, we'll discuss this again when we discuss diabetic retinopathy in the future. Not now. This is another good example. You can see the title, you can see the video, what is happening. This is a treatment of the complications of cataract, one we discussed. After cataracts or secondary cataracts, which is a complication. उसमें हमने Elshnick pearls discuss किए थे, उसमें हमने secondary polar cataract discuss किया था. So you can see this is the cataract, and this is present behind the intraocular lens. Okay? So you can see how this laser, it creates holes. You can see how it creates holes, how it destroys the posterior capsule and makes an opening. So as the title indicates, this is a YAG laser, which is being used for YAG capsulectomy for after cataract. This type of laser, it is a photoablative laser. YAG, and it's used for capsulectomy. So the last type, it's used in this procedure. What is happening over here? क्या हो रहा है? Can anyone tell what is happening?
कॉर्निया की कर्वेचर
curvature change हो रहा है. So the thing which he pulled down, जो थोड़ा सा change है, that was the corneal epithelium. So something is happening to the stroma. The stromal density, the stromal curvature is being changed in this case. This is a LASIK surgery, LESEK, laser epithelial keratomeiosis. And this and the laser which is being used, it's an excimer laser. Excimer lasers are used in LASIK. They are used in, I think they are, excimer is a type, and they are called photorefractive lasers. So it's not photorefractive. So these are the three types of lasers and examples which you have to remember. क्योंकि कभी-कभी पूछ लेते होते हैं which type of lasers are used. Photocoagulative is argon. It's used for pan-retinal photocoagulation. Photoablative is YAG. Refractive is excimer. And these are the uses. एक वीडियो आ रही है इसके यूज. This was a little bit about the lasers which I wanted to discuss. We're done with glaucoma now. Does anyone have any questions? Feel free to ask. I have a question. Which topic should we do next? We're almost at the end of the original session. We will start again the topics for दोबारा हम शुरू करेंगे for those people who are new. But there are a few topics left, including refractive errors, optic nerve, and orbital trauma or ocular trauma. These are three topics left. Which one should we start first? That is the question I want to ask. कि आप लोग ग्रुप में रिप्लाई कर दें इसका. So the topic which we have consensus, inshallah, will start on the day after tomorrow. और इसके साथ साथ on the next Monday, inshallah, या उसके इर्द गिर्द around that time, I'm also preparing a test to cataract, glaucoma, और पीछे कोई एक और टॉपिक देख लेते हैं, उसका एक टेस्ट भी कर लेते हैं. So yes, anti-YAG and YAG lasers are the same. ठीक है? These lasers are the same. मतलब एक ही कॉम्बिनेशन यूज होते हैं. एनडी-YAG लिखा आएगा यूजुअली. ठीक है, डबल फ्रीक्वेंसी YAG और lasers भी होती है, लंबा किसी कहानी है. बट व्हेन आई से YAG, it's actually ND-YAG. That is correct. Test for measuring corneal diameter. Which is a test for measuring corneal diameter? किससे हम मेजर करते हैं? Keratometry से करते हैं ना. We discussed this in cornea. Curvature हम measure करते हैं. तो the curvature is मतलब curvature से हमें पता लग जाता है तो कि क्या है उस टेस्ट में. और secondly, corneal diameter isn't very difficult to measure on slit lamp examination as well. Slit lamp पे what they have is used shaded lenses जिनके ऊपर measurements लिखी आ जाती है. तो आप जब इसको person से कहते हैं कि आप आंखें पूरी खोलें and they open their eyes, so you measure the distance from the pupillary margin to the sclera on those lenses slit lamp के अंदर होते हैं. उनके ऊपर जैसा आपने सेकंड ईयर में एग्जामिनेशन की थी वो परफॉर्म ल्यूकोसाइट काउंट माइक्रोस्कोप से, जिस पर ग्रेडिंग्स आती है ना, उस पर लेंसेज से भी आ जाती है. बट दैट कैन आल्सो बी यूज्ड.
भाई आपने इन्फेंटाइल ग्लूकोमा में एपिकेंथल फोल्ड्स का जिक्र किया था, तो उसकी क्या यानी कि
this is actually an incidental finding. I wanted to discuss this epicanthal folds because epicanthal folds हमने discuss किए थे when we discussed strabismus. I don't know if you've been in the strabismus lectures, but epicanthal folds can cause pseudostrabismus or pseudosquint. इनकी वजह से लगता है कि हो जाता होता है. So I was actually talking in that context specifically. We'll discuss pseudosquint and squint when we do. If you don't have any questions, if you have any questions, we'll end this with the session now.
Intercanthal distance increase हुआ है इस पिक्चर में. Intercanthal distance भी increase हुआ है.
Because you cannot in this low picture you cannot actually see the inner canthus कहाँ end हो रहा है. आप यहाँ पे तो देख सकते हैं, यहाँ पे आप नहीं देख सकते. Because the epicanthal fold is coming over the inner canthus. Inner canthus के यहाँ पे होगा इसके नीचे. So it looks increased. There's flattening of the nasal bridge as well, जो बच्चों में usually होती है. Yeah, it's incidental finding. Yes, epicanthal intercanthal distance looks or appears increased, and that is one of the reasons a pseudosquint कराता है. So if you know what pseudosquint is, नहीं है, नहीं पता तो कोई मसला नहीं, we'll discuss this इंशाल्लाह। स्टार्ट करवा दें भाई, बिकॉज हमारा टेस्ट भी आ रहा है, ऑप्टिक नर्व का टेस्ट आ रहा है आप लोगों का, तो ठीक है करवा लेते हैं, लेकिन ग्रुप में आपने मेरे बताना है टेस्ट किस दिन आ रहा है, ये भी ग्रुप में बता दें, और जितने लोग एग्री हैं ग्रुप में बता दें, तो we'll discuss ऑप्टिक नर्व इंशाल्लाह। तो with that being said, this ends our session. Take care everyone. Allah Hafiz.